Hi, this is Dr. Eric Dein coming at you with Room Now, faculty at EULAR Conference Day 1. It was an excellent first day of the conference. I'm going to start by talking about oral presentation 0010. And this was the FLORA trial looking at fecal transplantation as a potential therapeutic option for psoriatic arthritis. So what this comes off of is the prior literature and thoughts about the gut-joint relationship in psoriatic arthritis and spondyloarthritis diseases. The thought being a microbial dysbiosis can contribute to subclinical gut inflammation, which correlates with joint inflammation, possibly through translocation of bacterial products that create a molecular mimicry that leads to peripheral joint inflammation. So the FLORA trial was looking at fecal transplantation as an add-on therapy for psoriatic arthritis. The patients included had active peripheral psoriatic arthritis. They were treated with stable doses of methotrexate at the maximal tolerated dose, 15 to 25 milligrams, for at least 3 months. They were then given the addition of a fecal transplantation or a sham transplantation. And the study was looking at a primary endpoint of the proportion with treatment failure, which meant the need for drug escalation through 26 weeks. It also looked at a variety of activity scores as a secondary measure. So the eligible patients all met the CASPAR criteria. They had at least 3 swollen peripheral joints. And as I said, on the steady state of methotrexate monotherapy, all aged between 18 and 75 years old by inclusion criteria. They excluded patients with other causes of inflammatory arthritis, cancer, infections. They notably excluded patients with inflammatory bowel disease, as well as patients with food allergies, food intolerances, or celiac disease. The results were interesting. It showed that the sham transplantation was superior to the fecal transplantation. So this was a negative trial, actually, more than negative, with sham being better. So there were 9 treatment failures in the treatment group, 9 out of 15 patients, with only 3 out of 16 in the sham group. So there was a significant benefit to being in the sham group with a p-value of under 0.02. The HAQ-DI score was also improved in the placebo group and not in the fecal transplantation, again with significance. What was reassuring is the safety data was encouraging. There's no serious adverse events in either groups. The total non-serious adverse events were pretty similar between the 2 groups, and actually showing more infections in the sham group, with only 3 out of the 9 infections in the fecal transplant group. So I do think kudos to EULAR for talking about a trial that was negative and having this as part of the plenary sessions, because I think we often focus on the bias of positive findings. I think it's a very interesting idea. I think it would have been a nice proof of concept to see a response. The clinical significance of it, I think, would require more thought as to this procedure. But I think it is interesting to think about the concept of the gut-joint relationship. The obvious limitation was this was a pilot study with a very small study population of 31 patients. There was significant improvement in the sham group, which was interesting and not expected. So I think that requires further thought, and especially in such a small group. They had just 1 fecal transplantation, which the thought being maybe on repeat transplantations may change the efficacy of it. Again, I think this is a very interesting idea. It proposes further thought, discussion. It's a shame it didn't show positive findings, but I think there is more that can be done to look at the microbiome more directly and see what responses may happen after fecal transplantation, and see if we could correlate that to launch, I would hope, a bigger study to look into this a little bit more. Thank you very much. I look forward to continuing to check in throughout EULAR, and for more information from me and my colleagues, take a look at roomnow.com. Thank you.